How do you treat knee arthritis without surgery? Let's break down 10 legit ways to reduce pain, move better, and get stronger without going under the knife. My name is Dr. Dominic Rangel, and I'm a physical therapist. I help people just like you take control of their joint pain using movement and science, not just quick fixes. So let's get into it. First things first, you got to modify your activities. Don't stop moving. If your knee hurts, don't just rest forever. That makes things worse. The key is to stay active, but adjust what you're doing. If squatting deep hurts, try partials. If running hurts, try cycling or walking hills. Maybe it's a training issue where you're running too fast or too long for the capacity of your knee currently. It doesn't mean it can't be built up. Movement is absolutely medicine, but the right dose matters. Two is you have to think about weight loss. Even 10 to 15 pounds helps. Look, this isn't about aesthetics, it's physics. Every extra pound added adds stress to your knees up to 7 times the body weight when going down the stairs. Even small weight changes can take pressure off your joints and reduce daily pain. Three, physical therapy, not just exercises, strategic exercise selection. A customized plan, let me repeat, a customized rehab plan can help strengthen the muscles that support and protect your knee. A good PT isn't just handing you a printout. They're watching you move and helping you correct patterns. This is one of the most evidence-based ways to improve function long-term. Four, if your pain is more on one side of the knee, like the inside of your knee or the outside of your knee or under the kneecap, you may need bracing and orthotics when you need a little help. A well-fit brace or shoe insert can help redistribute that pressure and take the loads off of those areas. Those aren't forever tools. They're just support strategies to get you moving better while you're building strength and control. Number five, inflammatory foods can crank up joint pain. You've got to dial in the nutrition. Fuel your joints the right way. Start by reducing things that are very simple, like sugar, alcohol, and processed. You got to add more anti-inflammatory foods like fatty fish, colorful fruits, veggies, and whole grains. It's not magic, but it's a foundation for better healing. Six, let's talk about over-the-counter meds. Things like acetaminophen, Tylenol, or NSAID like Advil or Aleve can help in the short term. Just don't rely on them forever. NSAIDs reduce inflammation, but can impact your stomach or your kidneys. Think of these as tools for flare-ups, not daily solutions. They aren't meant to be taken long-term. There has to be a better solution. Number seven, there's mixed evidence here, but supplements, things like turmeric, glucosamine, MSM, peptides. Some people feel real relief, others don't. If you try something, track your results and make sure it doesn't interact with other meds, and confirm with your physician or your primary care doc that those things are okay for you. Number eight, some people require stronger anti-inflammatories, and that can make a difference. You may need prescription meds to get you over the edge and nudge you in the right direction. We generally would like to avoid opioids for arthritis. They don't target the root cause, and they carry big risks. Number nine, topicals and injections. Topical creams with anti-inflammatories or CBD can provide localized pain relief. Injections like corticosteroids or hyaluronic acid may help reduce pain or improve joint fluid quality, but their effectiveness definitely varies from person to person. Number 10, don't overlook this last piece. But using ice, it's simple but effective. Cold helps reduce inflammation and dulls the pain. Just don't overdo it. 15 to 20 minutes max, and you're home free. If you're dealing with knee arthritis, there's a lot you can do without surgery. But here's the key. You need a well thought out plan. That means movement, load management, and consistency. Not everything works for everyone, but something will work for you. If you want help figuring out where to start, feel free to reach out. The info for this is in the description. Your knees aren't done. They just need the right approach.